Hey guys, Dr. Ryan Davis with Thrive Chiropractic in Montgomery, Alabama. Prior to this, we've talked about what to look for in an evaluation, a proper evaluation from the clinician that you choose to see for your musculoskeletal injury. Today I wanted to talk a little bit about the treatment that you should look for. So it's real common to maybe fall in love with a certain technique or a passive therapy, something like stem, ultrasound, cryo, laser, dry needling, cupping, manual therapy, things like that, where you as a patient lays there and someone or something does something to you. So although that's a great tool to kind of calm down or desensitize that pain signal, it's not the most important thing. By far the most important thing that you can get in terms of treatment is advice and education, meaning a thorough evaluation, an understanding from your clinician of the demands that you put on your body if you're a CrossFit athlete, a runner, a triathlete, and then getting sound advice and education on where to move forward from there, followed by movement. So as we've talked about in previous videos, the next most important thing is the fact that they are doing a full functional movement-based assessment, modifying or changing the movement variables to help you move in a way that unloads or takes stress out of the area that you're injured in. So that takes time. That means a very thorough evaluation, a lot of knowledge on the clinician's part of the sport that you're involved with, and then taking the time to modify that movement. Next would be some sort of resistance exercise. So the passive therapies, the cryo, the laser, the stem, that stuff does nothing physiological to the tissue. It doesn't create strength or resiliency or change the tissue in any way, whereas resistance exercise does. The only way to change tissue is to create force and stress through that tissue, and an adequate enough of a stress to force the body to adapt, to grow stronger, to grow more durable and more resilient, and that happens through resistance exercise. So to recap, the most important things that you should be looking for in your treatment plan is solid advice and education. They're taking time to talk you through things, educate you on your condition, that they're looking beyond the side of pain to work with movement, how you move in your chosen sport or activity, and that they're giving you some resistance exercise, something to build durability and resilience in the tissue. After that, manual therapies and the passive therapies are important tools to kind of calm the pain signal down, but only if you've done all the other things that should precede that. So hope that helps you identify what to look for in your treatment plan. Thanks.